CET coaching organized by the Karnataka State Pre-University Education Board. I am Shruti Ramaswamy. I will be dealing with certain topics like digestion and absorption, breathing and exchange of the gases, body fluids and circulation. At the very outset, let us know what is the synopsis regarding this digestion. We shall know the definition. Digestion is a catabolic process of conversion of the complex non-diffusible food substances to the simpler diffusible food substances. It can't happen on its own. It needs the action of hydrolytic enzymes. Children, we all have learnt all living organisms will have the metabolic processes. Amongst the metabolic processes, one is anabolism, the other one is the catabolism. Digestion and respiration both happen to be a catabolic process. So here whatever food we consume, they are not in a diffusible state, but by the action of the hydrolytic enzymes, they get converted into a diffusible state and can get absorbed. Let us know the types of the digestion. In the animals we find there is intracellular digestion as well as extracellular digestion. Intra, the very word is saying it is within the cell that the digestion process gets carried out. Extracellular digestion is nothing but the digestion occurs outside the cell but within the lumen of the body of an organism. Amoeba and in sponges we find it is having intracellular digestion. There will be a temporary stomach called the food vacuole within which there would be the digestion that gets carried out. Amongst the human beings we find there is a wide lumen within which the digestion occurs. Let us start up with the human digestive system. For our convenient studies, we bifurcate this into accessory digestive structures, alimentary canal and then digestive glands. Accessory, they are not directly involved in digestion, but rather they help in digestion. Cheek forms the boundary of a buccal cavity. Palate is the roof of the buccal cavity. Ula, kirnalge ante en karitivi, that's a small muscular structure which helps during swallowing process. Tongue and teeth. Alimentary canal is a long tubular structure extending from mouth to anus. It includes pharynx, a common passage for both windpipe as well as the food pipe, esophagus, J-shaped structure stomach, small intestine and large intestine. Within our body we have the digestive glands. There are 5 of them: salivary glands, gastric glands, liver, pancreas and intestinal glands. What's the role of the teeth? The human dentition is nothing but the mode of arrangement of the teeth in the buccal cavity or jaw. The teeth is thecodont type, in the sense the teeth or the tooth is embedded within the jaw socket. It is diphyodont type because in the lifespan we get 2 sets of the teeth. One is a milk teeth or deciduous teeth. The other one is a permanent teeth. The milk teeth droops down at the age of 6 to 8 and then is replaced by permanent set of the teeth. We can find that the teeth differs in their structure and as well as in their function. So we call it to be as heterodont. Incisors are there, wide, chisel shaped, they help in chopping the food. Canines, they are sharp, they help in tearing the food. Premolars and molars, they are cusp shaped, they help in grinding the food. We find that the primary teeth has a dental formula 2102. The milk teeth does not possess the premolars. Permanent teeth dental formula is 2123, bar 2123, half the set in the upper jaw and half the set in the lower jaw. We have in this slide a primary teeth diagram as well as the adult teeth diagram. See here, we can see incisors, canines are there, premolars and molars. Premolars are absent and it's only molars. But here, in case of the adult teeth, you can see there is presence of the premolars. So the dental formula here will be 2102, whereas here it is 2123. The digestive glands, salivary glands, they are of three pairs. One pair of the parotid gland, one pair of the submaxillary gland and one pair of the sublingual glands. All the three pairs of the glands secrete saliva. The composition of the saliva is 98% of water, remaining is salts, mucin, lysozyme, a bacteriolytic enzyme, and ptyalin, which is a carbohydrate. The pH of the saliva is 6.8 to 7.2. It is neutral. Only at this particular range of the pH, the carbohydrates can work upon its substrates. Gastric glands. These are located in the stomach. They secrete the gastric juice. We have a very acidic pH within the stomach. It's all because there is presence of oxyntic or parietal cells that secrete HCl, zymogenic or peptic cells or chief cells, they secrete the zymogens. We need to know what is zymogen. It's a inactive state of the enzyme. The zymogens of the stomach are pepsinogen and prorenin. Goblet cells, millions of goblet cells, they line the walls of the stomach. They secrete mucus. What a wonderful creation it is. HCl, there is a chance that it may corrode the wall of the stomach. It doesn't happen so, because mucus is being secreted by the goblet cells and protects the walls of the stomach. Next, liver. Liver is considered to be as the largest exocrine gland of the body. It secretes the bile juice. Very synonymously, we use the term metabolic mill of the body. Liver is called a metabolic mill because maximum metabolic activities takes place within the liver. The fat metabolism, carbohydrate metabolism, then protein metabolism. You can see alcohol metabolism also occurs within the liver itself. The components of the bile juice comprises of water, bile pigments, bilirubin and biliverdin. How are they formed actually? We call liver to be as a crematorium of the RBC. The old and the worn out RBCs will be destructed within the liver. As a byproduct, there is production of these two pigments, bilirubin and biliverdin. Bilirubin imparts yellow color, biliverdin it imparts the green coloration. Bile salts are there, sodium and potassium, glycocolate and taurocolate respectively. Cholesterol and phospholipids also happen to be a component of the bile juice. See, the only digestive juice which does not possess any sort of the enzyme is the bile juice. What's the pH of this bile juice? It is alkaline, 7.6 to 8.6. You may wonder, there are no enzymes, but what's the role of this bile juice? Most important role is played because it helps in emulsification of the fat. The larger globules, they are broken down into the simpler granules by the action of the bile salts. Exactly as the soap solution, this would be converted into. Pancreas. We call this pancreas to be a heterocrine gland or a mixed gland or a pinkish break. Pancreas has endocrine part as well as the exocrine part within it. That's why It's considered to be as heterocrine gland, or else you can also call it dual gland. Children, you know what is endocrine gland? A gland which does not possess any sort of the duct but directly secretes its secretion into the bloodstream. The endocrine part of the pancreas is islets of Langerhans. This is islets of Langerhans. So here you can see there are varieties of the cells. It appeared just like that of a small island to Mr. Langerhans, and henceforth the name has been given islets of Langerhans. Amongst the cells here of prime importance are alpha cells and beta cells. Alpha cells secrete the hormone called glucagon. We call this hyperglycemic factor because it increases the blood glucose concentration. Beta cells secrete insulin. We call this to be as hypoglycemic factor because it decreases the sugar level or the glucose level in the blood. The exocrine part of the pancreas is acini. The acinar cells just secrete out the pancreatic juice loaded with the digestive enzymes, and they are just conveyed through the duct. So, it is a exocrine part of the pancreas. Later, we have the intestinal glands. The intestinal glands are constituted by crypts of Lieberkühn and Brunner's glands. The crypts of Lieberkühn secretes the enzymes. Brunner's glands secrete mucus. Both associated together, you call that to be as the intestinal juice or succus entericus. Let us now look at the TS of the gut. The outermost layer of this is made up of serosa, squamous epithelial tissue. Below the serosa, there is a muscular coat made up of smooth muscle fibers. Towards the outer side is the longitudinal muscle, and towards the inner side is the circular muscle. It forms a very thick coat. Later, below this layer is submucosa. It is made up of areolar connective tissue, and below the submucosa is mucosal layer. It comprises of the smooth muscle fiber as well as connective tissue, and there are finger-like projections which we call it to be as the villi. There is a lumen. There is a lumen within which the digestion process gets carried out. This is an enlarged picture of the villi. The lining of the lumen is made up of the absorptive as well as the secretory cells. Absorptive as well as the secretory cells. The epithelial tissue, columnar type of the epithelial tissue, it has on its free surface finger-like projections called microvilli. The microvilli, villi and plicae circularis, all three together, they increase the surface area for absorption. There are certain secretory cells which lie at the base of the villi. These are Penneth cells or Argentaffin cells. On the inner side of the villi, there is presence of the lacteals. They are nothing but the lymph vessels. There is presence of intricated network of the blood capillaries. The digested food from the lumen is absorbed. Those which are easily soluble in the blood enter into the blood, rather in the water enter into the bloodstream, and those digested food, so which are not readily soluble in water, they enter into the lymph stream. Have a look at this. At the base of the villi, there would be Penneth cells which secrete the enzymes and Argentaffin cells which secrete the hormones. The process of digestion. We can classify the digestion process in two methods. One is a mechanical digestion, the other one is chemical digestion. where there is no direct involvement of the chemicals, just by the movement the food is broken down, you call it to be as mechanical digestion. If at all there is involvement of the chemical substances like enzymes, then we call it to be as chemical digestion. Mechanical digestion may be the mastication of the by the teeth, mastication of the food by the teeth, and breaking of the food by muscular action. In the stomach we find there is churning movement, and while the food is propelling forwards, there would be peristaltic movement. It is nothing but a wavy like contraction and relaxation of the muscles surrounding the alimentary canal. We call this peristaltic movement. It helps in forward propulsion of the food. Chemical digestion. In mouth, the food that we consume, in that starch, which is a polysaccharide, is converted into a disaccharide maltose by the action of salivary amylase or ptyalin at a pH which is neutral 6.8 to 7.2. The partially digested mass of the food from the mouth reaches the stomach by peristalsis, and this is said to be as bolus. Digestion in stomach. The digestion of proteins takes place only after the zymogens have been activated. The zymogens like pepsinogen and prorenin are activated by an activator HCl. Later, proteins, they are broken down into proteoses, peptones and polypeptides by the action of pepsin. Casein, which is a milk protein, is converted into calcium paracasinate in presence of renin and calcium. This process is said to be as curdling of the milk. It is only after the precipitation of casein the pepsin can act upon it. The calcium paracasinate is converted into proteoses, peptones and polypeptides by the action of pepsin. Renin, what we speak of this, is very active in its functioning only in the infants. It is neither acting in you nor in me. There are absolutely no carbohydrates in the stomach. So, no carbohydrate digestion occurs. It is because the stomach has a highly acidic environment. Very few lipids can be digested in the stomach. The semi-digested, semi-fluid, acidic mass of the food that reaches the small intestine from the stomach is called chyme. All the food substrates complete their digestion within the small intestine. Into the small intestine, pancreas, liver and intestinal glands pour out their secretions. So, together pancreatic juice, bile juice as well as succus entericus reach the small intestine and complete the digestion there. The enzymes that are secreted along with the pancreatic juice are pancreatic amylase, trypsinogen, chymotrypsinogen, procarboxypeptidase, nuclease and steapsin. Trypsinogen and chymotrypsinogen are considered to be as endopeptidases because in a long chain of amino acids, the inner peptide bonds are broken down by trypsin and chymotrypsin. What we speak of this trypsinogen and chymotrypsinogen are zymogens. They are activated by a non-digestive enzyme called enterokinase. Procarboxypeptidase getting activated by enterokinase or autocatalytic function of trypsin. Now, it acts as exopeptidase. It breaks down the terminal peptide bonds of a polypeptide chain. Steapsin is considered to be as the strongest lipase. See, enterokinase, it is a non-digestive enzyme. Why do we call it so? Because it does not work upon any substrates of the food. Instead, it just acts as an activator. There are no digestive enzymes as we studied earlier in the bile juice, but the salts of the bile juice help in emulsification of the fat in the intestine. Only after the emulsification, the emulsified fats can be just broken down by the lipases of the intestine. The enzymes of succus entericus, nothing but the intestinal juice, are maltase, sucrase and lactase as carbohydrases, tripeptidase, dipeptidase as proteases, intestinal lipase as lipases. The action of the enzymes over the food substrates are shown as follows. Proteins, peptones and proteoses converted into dipeptides by trypsin and chymotrypsin as well as carboxypeptidase. The carbohydrates in the chyme are hydrolyzed by pancreatic amylase. Children, wherever you get the term amylum, it indicates it is starch. Fats are converted into monoglycerides, nucleic acids into their simplest form, nucleosides by nucleases. At the end products of digestion, the proteins are converted into amino acids, the polysaccharides have been converted into glucose, and then the lipids are converted into fatty acids and glycerol. The end products of the digestion, they are in a diffusible state. The alkaline emulsion of the digested food in a small intestine is called chyle. Do you remember? We have studied three forms of the food. The food which is digested in the mouth reaching the stomach is called bolus. From the stomach to the intestine is called chyme, and now in the small intestine it is said to be as chyle. After the process of digestion, all the end products, they are absorbed. So through the intestinal mucosa, they reach the blood and the lymph. This process is said to be as absorption. The absorption may be carried out by various methods: a mere simple diffusion, a facilitated transport by the help of the sodium ions, osmosis, or else with the expenditure of the energy, active transport. The absorbed substances reach the tissues and there they are utilized for various activities. This process is said to be as assimilation. So, ingestion, digestion, absorption and then assimilation. Finally, undigested waste materials are thrown out through the large intestine. There would be solidification of the undigested waste material, and then the fecal matter is defecated out of the digestive system through the anus. Along with the normal functioning of the digestive system, we come across to study the disorders of the digestive system. Jaundice. This is just because of dysfunctioning of the liver, wherein it is caused because of hyperbilirubinemia. Hyperbilirubinemia. They may be obstructive jaundice, infective jaundice or neonatal type of the jaundice. Vomiting. If the food is not properly digested and it is stuck in the stomach, there would be a regurgitating feeling, and that is what is said to be as vomiting. Diarrhea. Dia is to pass through, rhea is flow. This is nothing but the defecation itself, wherein there is no solidification of the food, but watery fecal matter is very frequently passed out. Constipation. Wherever we come across the word con, it says something is getting accumulated. Like conference is there, conjugation is there. In the same way, we have a prefix here, constipation. In that con, it is saying accumulation of undigested waste material without getting defecated. Indigestion, overconsumption of the food, wherein there is a feeling of fullness in the stomach. This is said to be as indigestion. children, let us work out with some of the questions. The very first question goes like this. Digestion is a process of conversion of complex non-diffusible food substances into simpler diffusible food substances by the action of hydrolytic enzymes. It is, options go like this: mechanical, chemical, catabolic, anabolic. Of course, digestion is by both mechanical as well as chemical process, but very important is it is through a catabolic process that there is conversion of the non-diffusible food substances into the simpler diffusible food substances. This is the structure of the tongue. In the tongue, we have the various papillae: circumvallate papillae, fungiform papillae, and there is filiform papillae, foliate papillae. The question is, the small sized conical shaped papillae in the tongue, which are tactile in function. Tactile, they in no way help in perceiving the taste of the food, but they perceive the sensation of the touch. Which are those? Circumvallate, fungiform, filiform, and foliate. See, it is small sized, exactly at the central portion it is located. You call this to be as filiform papillae. The dental formula of milk dentition in man is, the options have been put forth here. I have specified the milk teeth does not bear premolars. So, it is 2, 1, 0, 2. You can also write bar 2102. This is 1/2 of the upper jaw and this is 1/2 of the lower jaw. The next question, match the cells given in column 1 with their secretions given under column 2. Choose the answer which gives the correct combination of the alphabets of the two columns. A. Zymogenic cells. We know what is a zymogen. It is the inactive state of an enzyme. Search for the zymogens here. It is pepsinogen. Oxyntic cells. We know in the gastric glands there are oxyntic cells which secrete out HCl. Goblet cells. Millions of them are there in the lining of the stomach just to protect the wall of the stomach. They secrete mucus. Panetha cells. Where do you find this? At the base of the villi of the small intestine. They secrete the enzymes. So, the option goes like this: AQ, BR, CS and D, P. In this question, we have a graphical representation. On the x-axis, we have selected pH. On the y, there is a rate of reaction. Read the graph properly. A, B and C in the graph, they are the action spectra of 3 digestive enzymes. Find the right option. See, pH will have to look into. 2 is highly acidic, so it might be the enzyme of the stomach. 7 is very alkaline, rather it is neutral. 8.6 is very alkaline. So, if it is 7, it might be an enzyme of the mouth. 8.6 might be in the small intestine. A, pepsin, B, ptyalin, C, trypsin. So, just see here, we are observing the enzymes are very specific to the pH. any fluctuation in the pH, we do not find the enzymatic action. This is how you will read the graph and find the choice. Which of the following is not a correct match of glands and enzymes? Pancreas, liver, intestinal glands and gastric glands. Respectively, the enzymes have been given. They have asked which is not a correct match. Liver, steapsin. We know never liver will secrete any sort of the enzyme. So, steapsin is a very strong lipase being secreted by the pancreas and not the liver. Next question. Stenson's duct is associated with. We know within the buccal cavity, we have 3 pairs of the salivary glands. A pair of the parotid gland just located in front of the ear on the inner side of the cheek. One pair located just behind the lower jaw, submaxillary gland, and one pair located below the tongue. It is sublingual gland. The duct that is associated with the parotid gland is the Stenson's duct, wherein the duct of Rivinus and Watson's duct, they carry the saliva from the submaxillary and sublingual gland. See, we have 2 here, submaxillary and submandibular. Both are synonymously used there. Next question. The first step in digestion of fat in the intestine is. I have told you children, without the emulsification of the fat, no enzyme can work over it. So, the first step in the digestion of the fat is emulsification. The next question. Large amounts of unabsorbed fat are eliminated out of the body and is one of the conditions of obstructive jaundice. The statement B says, entry of bile into the small intestine, it is prevented during obstructive jaundice. The options say like this, both the statements A and B are correct, B is the reason for A. Both the statements A and B are correct and B is not the reason for A. Statement A is correct but B is wrong. Statement A is wrong and B is correct. Let us work it out. See, large amounts of unabsorbed fat. Fat is not getting absorbed but it is just eliminated out of the body. It's one of the conditions you find in obstructive jaundice. The statement B is saying entry of the bile into the small intestine is prevented during the obstructive jaundice. Let us look into this answer. Both A and B are correct and B is the reason for A. I have a slide for this. See, these are all gallstones. You can also call this gall calculus. In an obstructive jaundice, these gallstones or gall calculus, they are formed within the gallbladder. There is a chance that it might enter into the cystic duct and may block the passage. The secretion of the liver as well as the pancreas, both are conveyed through a common hepatopancreatic duct into the intestine. But now the stone is blocking the passage. So, no chance of the bile entering into the small intestine. It is unabsorbed and it is eliminated out of the body. So, reason for this is the entry of the bile into the small intestine is being prevented because of this obstructive jaundice. So, the answer is both the statements A and B, they are correct. B is the exact reason for A. Next question. Note the relationship between the first 2 words and suggest a suitable word for the 4th place from the choice given below. This is a condition of deficiency of the vitamins. Vitamin B deficiency leads to beriberi. Then vitamin D deficiency leads to what? Options are scurvy, night blindness, rickets, delayed blood clotting. Children, our diet should be properly balanced. Vitamin is a must for the body. If at all we run short of the vitamins, we end up having one or the other disorders. So see, scurvy is caused because of the deficiency of vitamin C. Night blindness because of vitamin A. Rickets is because of vitamin D, wherein the bones are not properly formed. Delayed blood clotting, it is because of vitamin K. See, you are looking at the picture here. The signs of rickets: soft spot on baby's head and is very slow to close, bony necklace, curved bones, big and lumpy joints. There will be arched legs, bowed legs. Better not enter into this and have a proper diet. The death of the intestinal bacteria will cause reduced synthesis of vitamin B complex and vitamin K, reduced excretion. If we do not drink water properly, then there would be abnormal functioning of the kidney. A tired feeling is also seen, and blurriness in the vision is also seen. But synthesis of the vitamin B complex and vitamin K is because of the intestinal bacteria, which we call it to be as the beneficial bacteria, Escherichia coli. A special portal system present in all vertebrates is renal, hepatic, pulmonary, hepatorenal. We are gifted with a beautiful gift with the hepatoportal system. We find the blood capillaries from the intestine and the stomach. They are all connected to the liver. Liver acts as a check post. It is a metabolic mill of the body. So, a special portal system present in all vertebrates is the hepatoportal system. What is the significance here? Homeostasis is the central dogma of physiology. Homeostasis is a central dogma of physiology. Body itself is beautifully balanced. Homeo is same, stasis is referring to static condition. So, it's maintenance of the internal body environment within the tolerable limits, and this is the dogma of physiology. Body regulates on its own the whole chemical components within the body, and for this they have their own system which is adjoined and functioning together. Next question. No proper digestion of food and having a feeling of fullness is a symptom of indigestion. I have explained what it is. So, overfeeding without providing proper time for the digestion of the food. So, this leads to the indigestion. Which of the following pair is not correctly matched? Cystic duct, pancreas, crypts of Lieberkühn, gut, sphincter of Oddi, duodenum, pyloric sphincter, stomach. We know cystic duct, this is a duct that emerges out from the gallbladder. So, cystic duct is associated with the gallbladder and not the pancreas. If at all it is from pancreas, it will be a pancreatic duct. Crypts of Lieberkühn. So, at the base of the villi, we find the crypts of Lieberkühn. There is another word, sphincter of Oddi. Sphincter of Oddi. The sphincter, it refers to the muscles, the thick musculature. So, which would be helping in the normal propulsion of the food into the next organ. Pyloric sphincter. At the posterior region of the stomach, we get the pyloric sphincter, which conveys the food properly into the duodenum. Arrange the following events in the processes of digestion in a proper sequence: ingestion, digestion, later on it will be absorption, assimilation, and then the defecation. I repeat: ingestion, digestion, then absorption, assimilation, and later it is defecation. So, option C is the correct answer. Let us start up with the next chapter, breathing and exchange of gases. What we are seeing here is the entire respiratory system. The basic functional and structural unit of the lungs is the alveoli. Let us at the very outset know what is the definition of respiration. In your lower classes you have learnt it is exchange of the gases. That's it. But an exact definition goes like this. Respiration is a catabolic process wherein there is intake of oxygen rich air. It's not just oxygen, but it is oxygen rich air into the lungs, utilization of the oxygen for the oxidation of the food, and then removal of carbon dioxide rich air from the lungs. Now, types of respiration amongst the animals. One is a direct respiration, the other one is indirect respiration. What do we actually mean by this? A direct respiration is nothing but exchange of the gases between the body surface and the surrounding environment. But in an indirect respiration, from the surroundings, the air enters into the lungs, reaches the blood, and from the blood it is being carried to the cellular site. So, we say it is indirect respiration. The respiratory organs amongst the organisms, different organisms, may be skin, trachea, gills, and lungs. A human respiratory system, it comprises of the conducting parts and respiratory parts. Conducting parts and respiratory parts. The conducting parts are the ones which just allows the passage of the air, but respiratory parts are the ones which really help in exchange of the gases. Like terminal bronchioles, the alveoli, here really the exchange of the gases will occur, and that's why we call them to be as the respiratory parts. Nasopharynx is there, nasal passage, the entry through the nostrils, nasal passage, then the nasopharynx, and then comes the larynx, the voice box. There is trachea, there will be the bronchi, its branches, bronchioles, and finally the alveoli. Very important process occurs in the nasal passage. So, what exactly happens here is the air that we breathe in will be filtered, moistened, sterilized, warmed, and then it enters into the trachea. This is another diagram wherein you can see the thoracic cavity very clearly. The two soft organs, lungs, are being given the protection on the dorsal side by the vertebral column, and there would be 12 pairs of the ribs which are said to be as costa even, which protect the lungs. They form the walls of the thoracic cavity. In between the ribs, we find there would be intercostal muscles, a set of two, external and internal intercostal muscles. The very word costa, it says it is ribs. On the ventral side, there is presence of sternum. On the floor of the thoracic cavity, we find a dome-shaped structure made up of the skeletal muscle, and that is diaphragm. Every organ is beautifully protected by the membranes. The membrane that encloses the lungs are pleural membranes. There are a set of two membranes here, external pleural membrane and internal pleural membrane, parietal pleura and visceral pleura. In between these two, there lies the pleural space. There lies a pleural space which is filled up with the fluid content, which avoids the friction while the breathing process is getting carried out. The whole trachea is being guarded by the rings of gristle or cartilage. Let us now know the mechanism of respiration. It includes breathing, which would be including two sub-processes, inspiration and expiration, or inhalation and exhalation, external respiration, transport of the gases, and internal respiration. Look at this picture. How does this inhalation take place? How will exhalation occur? Inhalation is an active process because of the muscle contraction, but exhalation is a passive process because the contracted muscles just relax. While inhalation to get carried out, there should be a gradient between the atmospheric pressure and intrapulmonary pressure. It is diffusion from the region of higher concentration or higher pressure to the lower pressure. So what should happen to the intrapulmonary pressure? It should decrease. It should decrease than that of the atmospheric pressure. To decrease the pressure, what should happen? Volume should increase. So, the ribs have in between them the intercostal muscles. The external intercostal muscles will undergo a contraction, due to which ribs move upwards and outwards. Diaphragm muscles, they are made up of skeletal muscles, they contract. As a result, the dome-shaped diaphragm will become flattened. Dome-shaped diaphragm will become flattened. So, the thoracic cavity volume increases, intrapulmonary volume also increases, so air gushes into. But in exhalation, muscles which had contracted relax. Ribs move inwards and downwards. The flattened diaphragm, it becomes dome-shaped. As a result, the air gushes out. So we find in the mechanism of the respiration, there would be external respiration and internal respiration. What actually happens here? The air that we breathe in reaches the lungs. Alveoli has an intricate network of the blood capillaries. There is exchange of the air between the blood and the cell, you call it internal, but when it is between the lungs and the blood, you call it external respiration. So first it will have to reach the blood, later on from the blood it will have to enter into the cell. So when it is exchanged between the blood and the cell, you call it to be as internal respiration. Transport of gases. Respiratory gases are of two varieties. One is the carbon dioxide and the other one is the oxygen. We need to study how they are being transported. The transport of oxygen will take place by two mechanisms. One, when it binds with the hemoglobin, forming oxyhemoglobin. The other method where oxygen is getting carried is through the blood plasma. So here in the dissolved state only about 3% of it is transported, but remaining 97% of the oxygen is being transported by the hemoglobin. Children, we usually call hemoglobin to be as a respiratory pigment. We have learnt hemoglobin as a conjugate protein. It has two parts within it, globin and heme group. The globin happens to be the proteinaceous part, whereas the heme group happens to be the prosthetic group or the prosthetic part, non-proteinaceous part. What we speak of this oxygen, it comes and binds in the ferrous ion which is present in the heme group, resulting in formation of oxyhemoglobin. When we use the term saturated, we mean to say that one hemoglobin molecule is carrying 4 oxygen molecules. Next, transportation of the carbon dioxide. Nearly 5 to 7% of the carbon dioxide is being transported as physical solution, wherein they dissolve in the plasma and gets transported. Now the question arises, why not more? When it is more, it will bring about the acidic condition. So permissible level is only 5 to 7%. Next, carbon dioxide binds with the hemoglobin and is being transported. See, hemoglobin transports oxygen as well as the carbon dioxide. Now the question is, where will it attach the carbon dioxide? Actually, hemoglobin has the proteinaceous part globin. When I say protein part, it usually will have the amino group. So to the amino group, carbon dioxide goes and binds. So one hemoglobin molecule can carry only one carbon dioxide molecule. When it binds, it forms carb amino hemoglobin. In this way, nearly around 15% of it is being transported, 15 to 20. Remaining carbon dioxide is being transported by bicarbonates of sodium and potassium. So whatever carbon dioxide is there, it enters into the RBC. It enters into the RBC. Within the cytoplasm of the RBC, there would be water. Carbon dioxide combines with water, forming carbonic acid. So it is at a faster rate that the carbonic acid is formed, because there would be carbonic anhydrase that is present over there. It's all a reversible reaction. Then we find it attaches to the sodium and potassium, forming the bicarbonates. Oxygen dissociation curve. All the reactions which were in the forward state now reverses when there is a partial pressure gradient. Oxygen which is being carried in the form of oxyhemoglobin and in a dissolved state, now as soon as the partial pressure of the oxygen decreases, it dissociates. The affinity of a hemoglobin to bind with oxygen is very least. If you subject hemoglobin before carbon monoxide, carbon dioxide and oxygen, it has greater affinity to bind with the carbon monoxide, then with the carbon dioxide, and later it binds with the oxygen. So when the carbon dioxide concentration is more and oxygen concentration is less and the pH is acidic, immediately we see the oxygen dissociates from the hemoglobin. Pulmonary volumes and capacities. They are being recorded by a device called the spirometer. What's the volume of the air that we breathe in normally It is the tidal volume and 500 ml of it. IRV is a inspiratory reserve volume. So when we inhale in the deep breathing, there would be around 3 liters of the air that we breathe in, and it is said to be as inspiratory reserve volume. When there is a deep exhalation, we just say it is expiratory reserve volume. The lungs should not get deflated, it should be inflated. A small amount of the air gets retained back in the lungs, and it is said to be as residual volume. There are capacities. Inspiratory capacity is nothing but the tidal volume plus inspiratory volume. Expiratory capacity is tidal volume plus expiratory reserve volume. So functional residual capacity is ERV plus RV. Vital capacity, when there is a deep breathing, the volume of the air that we breathe in and out is said to be as vital capacity. Total lung capacity is the volume of the air that the lungs can withhold within themselves. This is a picture of a spirometer. If you want to check the volume of the air that you breathe in and out, the nose would be clipped, and then you will have to breathe out, and there would be a graphical representation, as you saw in the previous slide, like this, which would be obtained by the rotating drum and a paper supply. The regulation of the respiration. I have told you homeostasis is a beautiful central dogma of the physiology. Regulation of the respiration is controlled by various structures within our body itself. Pons Varolii of the brain, it is a pneumotaxic center and regulates the rhythmic center. Medulla oblongata, it controls the respiratory rhythm center. Chemosensitive area, it actively functions when carbon dioxide and hydrogen ion concentration increases. It would just stimulate the elimination of carbon dioxide and the hydrogen ions. The receptors associated with the aortic arch and the carotid artery, they would signal the rhythmic center to expel out carbon dioxide as well as the hydrogen ions. This is another picture which is depicting the previous slide. The disorders of the respiratory system that you have learned: asthma, emphysema, occupational respiratory disorders. Asthma, easy inhalation but very difficulty in exhalation, because the conducting parts, the muscles that are encircling them, will undergo a spasm. Spasm is sudden contraction of the muscles. Look at the difference. This is a normal bronchiole, it has a wider lumen, whereas here, because of the spasm of the muscle, it has contracted. Lumen is narrow. No doubt, easily they inhale the air, but there is very difficulty during exhalation. Emphysema, it's beautifully called the smoker's lung disease. Can you look at the picture here? This is a healthy lung with a healthy habit. The person has maintained a healthy lung, but here, due to smoking, the lungs have turned out to become black. What happens? The smoke, the tarry content that is there, starts damaging the very sensitive alveoli. Henceforth, there is inflammation and the alveoli is totally damaged and being replaced by the connective tissue. Once damaged, is damaged permanently. The capacity of the lung slowly starts deteriorating, may lead to the lung cancer also. So it's a warning to the beginners. Occupational respiratory disorder. Based upon the occupation, there would be the respiratory disorder because the person would be exposed to the occupational air pollutants. Let us start up with the questions. In man, air passes from outside into the lungs through nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, and then alveoli. The alveolar epithelium of the lungs are made up of very thin squamous epithelial tissue, because the exchange of the gases will have to occur. But the upper respiratory tract will be made up of ciliated columnar epithelial tissue. Later, it gets converted into cuboidal, but when we reach the alveoli, it is made up of squamous epithelial tissue. The external respiration is a process of, I have explained in the previous slides, it is the exchange of the gases between the surrounding air and the blood. But if it is the exchange of the gases between the blood and the tissues, we call it to be as internal respiration. Carbon dioxide combines with hemoglobin of blood and forms carb-aminohemoglobin. What about this? Carboxyhemoglobin. So, when carbon monoxide combines with hemoglobin, then it results in formation of carboxyhemoglobin. This when hemoglobin combines with oxygen. The lungs are enclosed by a membrane called pleura. How about this? Periosteum. Every organ is given a protective covering. Wherever we come across the word osteo, it refers to bone. Peri, it refers to the surroundings. So, periosteum is a connective tissue that surrounds the bone. Peri, boundary. Chondro is nothing but cartilage. Perichondrium is the white fibrous connective tissue that just surrounds the cartilage. Pericardium. Peri is boundary. Wherever we come across the word cardia, it says it is heart. So, it is the protective connective covering of the heart. The next question, which combination of muscles contract and cause inspiration? Obviously, it is external intercostal muscles and diaphragm. But the same muscles, when they relax, the process will be exhalation. The picture which you had observed while the synopsis was given. The spirogram obtained from a spirometer indicates the different pulmonary volumes. Choose the correct answer from the choice that matches the graph. 500 ml, half a liter during normal breathing, the air that we take in and breathe out. This is inspiratory reserve volume, this is expiratory reserve volume, and this is the residual volume to keep the lungs inflated and not deflated. So, the answer is B. One of the following human cells cannot respire. Leukocytes are there, nothing but the WBCs. Intestinal cells are there, epidermal cells, erythrocytes. Which do you think does not possess the nucleus on maturity? Erythrocytes. So, erythrocytes do not possess the nucleus on maturity, nor do they have the proper number of mitochondria. So, they are the human cells which do not or cannot respire. An asthmatic patient suffers from easy inhalation but difficulty in exhalation. You see the lumen here as well as here, the spasm of the muscles, but this is the normal texture of the muscles. Inflammation of bronchi is to bronchitis. Allergic inflammation of the nose is to what? First, we should know what is inflammation. It is swelling along with the burning sensation. The word flammable is saying it is burning sensation. So, inflammation of the bronchi leads to bronchitis. Allergic inflammation of the nose leads to rhinitis. Whenever we come across the word rhino, it says it is nose. Have you heard about rhinoceros? So rhino is nose and keros is nothing but the horn. There is a horn over the nose of the rhinoceros, henceforth the name is so. We have the option here, myocarditis. Myo is muscle, cardia is heart, itis is the inflammation. Generally, a person who lives in higher altitude has rosy cheeks and lips, so he or she is characterized with which of the conditions? Leukocytosis, polycythemia, leukemia and thrombocytosis. It is polycythemia, increased RBC count. Why? Once again, homeostasis. Body itself has a beautiful mechanism. Higher the altitude, lesser would be the oxygen concentration. Body will have to combat to the prevailing conditions. Immediately, it starts producing much RBCs and that condition leads to polycythemia. Have you not heard about the doctor saying, a patient, go to the hill station, you will recover. This is the reason behind it. We have leukocytosis and leukemia. Both are the increased WBC counts itself. Leukocytosis is the normal increase of the WBC count under infection. But leukemia is the pathological increase of the WBC count. Increased thrombocytosis, increased count of the blood platelets, you just say it is thrombocytosis. If two men expire, in the sense exhale, the same volume of air, after normal inspiration, they have same expiratory capacity is the assertion. Reason, expiratory capacity includes tidal volume and inspirator reserve volume. A is correct, but R is wrong. Then what should it be? It is not inspirator reserve volume, but expiratory reserve volume and the tidal volume together constitute the expiratory capacity. Let us move on to the next chapter. It is body fluids and circulation. We shall start up with the next chapter. It is body fluids and circulation. A wonderful topic wherein we will be knowing about the fluids present in the body and how they are circulated. The Columbus of the circulation happens to be William Harvey, wherein other scientists and biologists did know about the other processes, but at the end they came to know what is the main that is required, and that was circulation. Definition: it's nothing but a cyclic movement of the blood from the heart to various parts of the body and again back to the heart. Amongst the animals, there are two types of the vascular systems. One is an open vascular system, the other one is a closed vascular system. In an open vascular system, we find there is heart, and for a shorter distance there is presence of the arteries, and directly it is pumped into the open spaces called the sinuses. There is no continuation of the blood vessels, so it's open type. In a closed vascular system, we find there is presence of the heart and the blood flows in a closed circuit constituted by the blood vessels. The components of the blood. Blood comprises of the plasma, then the formed elements, it is erythrocytes, leukocytes and thrombocytes. RBC is nothing but an erythrocyte. Then the WBCs or leukocytes are of different varieties. They may be granulocytes and agranulocytes. When I speak of granulocytes, they have a granulated cytoplasm, includes the acidophils, or eosinophils, basophils, then neutrophils. The agranulocytes include the monocytes and lymphocytes. They have agranular or non-granulated cytoplasm within them. Children, you should know this monocyte is considered to be as the biggest amongst the WBCs and is called the scavenger of the body. Neutrophils are called the shock troops of the body. They are around 70 to 80% of total leukocyte count. The components of the blood in another slide again. The blood plasma comprises of 91% of the water, 7% of the proteins like albumin, globulin, fibrinogen and prothrombin, and the solutes made up of ions, nutrients, waste products, gases and certain regulatory substances. Blood platelets less than 1%, leukocytes less than 1%, neutrophils, lymphocytes, monocytes, eosinophils and basophils, and erythrocytes less than 99%. We have blood groups. Karl Landsteiner takes up the credit of having unraveled the secret of the blood groups here. We know that they are of A, B, AB and O group. How can you identify that a person's blood is A group? It's based upon the type of the antigen present on the membrane of the RBC. If a person's RBC on its membrane has A antigen, then it is A blood group. If he possesses B, it is B blood group. If there are both the antigens over the membrane, then it is AB blood group. He has no antigens over the membrane of the RBC in his blood, then it is said to be as O group. Now, if it is an A antigen present in the A blood group, he might as well bear the antibody called the anti-B in his plasma. B blood group person will possess anti-A as an antibody in the plasma. AB will not bear any antibody but has both the antigens, so the person with the AB blood group is said to be as universal recipient. A O blood group person has no antigens but he has both the antibodies, so he will be considered to be as universal donor. Now, the blood clotting, which is possible because of the presence of the blood platelets. There is an injured area here. There are collagenous fibers. We can just have a look at it. The platelets and the damaged cells are visible. Plasma releases certain clotting factors, which would include calcium and vitamin K. Immediately, the prothrombin, which is in its inactive state, gets activated into thrombin by the presence of an enzyme called thrombokinase along with the calcium and vitamin K, and then this thrombin will convert the fibrinogen into fibrin. Fibrinogen is in a dissolved state, now gets converted into insoluble state called fibrin. So children, it's a must that calcium and vitamin should be available in the optimum concentration in your body for the clotting process to occur. Injured blood vessel, prothrombin activator, then calcium ions converting prothrombin into thrombin would be the thrombokinase. Then thrombin will act as a activator, convert the dissolved fibrinogen into the fibrin. So a mesh like network is formed and the clotting process has occurred. This is just who can donate blood to whom, who can be a donor and who can be a recipient. It's just a chart. Have a look at it. We call AB blood group person to be as a universal recipient, O blood group person to be as universal donor. Are you seeing something plus has been marked and negative has been marked over here? Plus is given as a symbol if at all they have another antigen called RH, rhesus factor, over the membrane of the RBC. If the person's RBC on its membrane does not possess this RH antigen, then we consider his blood group to be as negative. One erythroblastosis fetalis is a condition. Whether your horoscope matches or not, don't worry, see to it that which of the blood group is there when you marry with the person. If a woman is having RH negative and a man is with RH positive, and if they conceive a child, the child would be, if at all, RH positive. The first fetus development is not obstructed. A woman would normally deliver it. But in course of time, what happens? This antigens would have entered into the female's blood. The woman becomes sensitized to the antibodies and form to fight RH positive blood cells. So in the next pregnancy, the maternal antibodies will attack the fetal RBCs and henceforth may kill the RBCs of the fetus and leads to the delivery of a dead baby, erythroblastosis fetalis. So there is obviously the medication that can be provided. So she will be provided with anti-RH antibodies. VS is the human heart. So we will be seeing that the human heart is myogenic heart. The heartbeat originates by a set of the muscles. The human heart has 4 chambers, 2 receiving chambers and 2 pumping chambers, atrium and ventricle. The right atrium and left atrium are the receiving chambers, ventricles are the pumping chambers. So amongst the 2 ventricles, we would be finding the left ventricle has a very thick heart wall. The whole heart is covered by pericardium. It is parietal pericardium and visceral pericardium. The visceral pericardium can also be called epicardium. Then the heart wall comprises of the myocardium made up of heart muscles, cardiac muscles, and then there is a endocardium. There are blood vessels. Superior vena cava or precaval vein, posterior vena cava or postcaval vein, they carry largest veins of the body, carry the deoxygenated blood from various parts of the body, pump it into the right atrium. From the right atrium, it enters into the right ventricle through the auriculoventricular aperture being guarded by a tricuspid valve. From the right ventricle, the deoxygenated blood is carried to the lungs through the pulmonary artery, the only artery that carries the deoxygenated blood. In the lungs, they are oxygenated and brought back to the heart by the help of pulmonary veins. 2 sets of pulmonary veins. They drain the oxygenated blood into the left auricle or atrium. From there, it is pumped into the left ventricle through the left auriculoventricular aperture being guarded by bicuspid valve or mitral valve. Cusp is nothing but a depression. Bicuspid valve has 2 cusps within it and resembles the head dress of a bishop, which is said to be as mitire and henceforth called mitral valve. From the left ventricle, oxygenated blood is pumped to various parts of the body through the aorta, the biggest artery. Both the aortic opening as well as the pulmonary arteries opening are being guarded by semi-lunar valves. Semi-lunar valves, half moon shaped valves. The origin and conduction of the heartbeat. Heartbeat is nothing but the systole and the diastole together. Human heart is myogenic. It has the origin of the heartbeat by a set of the muscular tissue. It is said to be as sinoatrial node. It is also said to be as pacemaker. It sets an electrical impulse of contraction. AVN receives it. It is said to be as the one which substitutes the functioning of SAN, auriculoventricular node. This continues as bundle of His. It is named so after His Tavara. So, it is bundle of His. It enters into interventricular septum and branches out into the right and the left branches and runs throughout the ventricular region. On its walls, gives out the branches which are said to be as Purkinje fibers. A cardiac cycle. It is nothing but the total events that take place during one systole and diastole. Systole is a contracted state of the heart and diastole is a relaxed state of the heart. So, what is the heartbeat rate? It is nothing but 72 times per minute. What is the breathing rate? It is 16 times per minute. So, during this cardiac cycle, we come across the stroke volume and cardiac output. The volume of the blood that is ejected or pumped out of the ventricle per ventricular systole is said to be as the stroke volume. It is around 70 ml. Cardiac output. It is the volume of the blood that is pumped out of the ventricle per minute. So, it is nothing but stroke volume into heartbeat rate. So, stroke volume is 70 ml and then heartbeat rate is 72 to 75 times per minute. So, it comes around 5 liters of the blood that is being pumped out. Anyhow, the functioning of the heart can be assessed by a ECG. This is a graphical representation which is showing the functioning of the heart. It is electrocardiogram, which is recorded by a device called electrocardiograph. Here we have a wave P, Q, R, S and T. P is a atrial systole that is indicating. This is a normal ECG. QRS indicates the ventricular systole. Ventricular diastole is being represented by T. If a person has a myocardial infarction, we would be finding there is fluctuation in the wave of the T. If it is flattened, it is almost at the stage of the death. Double circulation. Heart pumps the blood. Once it reaches the lungs and again received back, and it reaches the various parts of the body and again received back to the heart. There is a shorter circuit, pulmonary circulation, and a lengthier circuit, it is a systemic circulation. The systemic circulation also includes the coronary circulation. Heart gets sufficed first and then pumps the blood to various parts of the body. That systemic circulation comprises of the coronary circulation, wherein the heart pumps the blood to its wall and again receives back from the wall the deoxygenated blood. The pulmonary circulation comprises of the pulmonary artery, which carries the deoxygenated blood from the right ventricle, takes it to the lungs where it gets oxygenated, and the oxygenated blood is drained back into the left atrium by the pulmonary vein. So here we would be finding from the aorta, the oxygenated blood is carried to all parts of the body from left ventricle, and from various parts of the body deoxygenated blood is carried to the right auricle by pulmonary artery, it is the superior vena cava and the inferior vena cava. Disorders of a circulatory system: hypertension, coronary arterial disease, angina pectoris, heart failure or myocardial infarction. Blood pressure is very much necessary to see to it that there is distribution of the nutrients as well as the oxygen. It is nothing but a lateral pressure exerted by the blood on the walls of the arteries. A normal blood pressure is 120 by 80 mm of mercury, wherein this is a systolic pressure and this is a diastolic pressure. If the recurrent reading of the blood pressure is more than 140 by 90 mm of mercury, then the person is considered to be as hypertensive. Coronary arterial diseases: any disorder in the coronary artery. This is an artery which supplies the oxygenated blood to the walls of the heart. This leads to the coronary artery diseases. So, angina pectoris, we call this to be as an alarm that rings prior to the myocardial infarction in non-diabetic person. So, this is severe. Angina is nothing but pain. Pectoris is the pectoral girdle. There is a shooting pain vigorously seen or felt by the person prior to the heart attack in his neck, descending down to the shoulders and then to the pectoral region. Reasons for the coronary artery diseases: this is self-made. Smoking, then increased blood pressure, increased cholesterol content, diabetic, and sedentary lifestyle. There is absolutely no vigorous working or burning of the calories. Myocardial infarction. Can you see here, children? This is a coronary artery which is supposed to supply the oxygenated blood to the walls of the heart, but now the lumen has narrowed because of atherosclerosis, the fat accumulation. So, blood flow or supply to the walls has decreased. So, there would be a myocardial ischemia, insufficient supply of the oxygenated blood to the walls of the heart. So, what happens? There would be the death of the muscles leading to the heart attack. Let us start up with the questions now. Mammalian heart is enclosed by pericardium. I have told you what perichondrium is, surrounding the cartilage, the white fibrous connective tissue. Glissen's capsule, it encloses the liver. Pleura, the covering of the lungs. Heart is located in, be very specific as you are a biology student, it is mediastinum. In between the lungs, it is mediastinum. No doubt it would be inclined towards the left side. What about the sella turcica? It's a bony case that gives the protection to the pituitary gland. Arteries differ from veins in having a thick wall. It's having a thick wall. Veins do have valves because there should be a unidirectional flow of the blood when they carry the blood from the lower part of the body. There should not be a regurgitation, henceforth they possess the valves, but arteries differ from the veins in having thick wall and they are deeply seated. The heart of the heart is made up of cardiac muscles. No other muscles we find in the wall of the heart. Systolic pressure is recorded on hearing the lub sound. during. There are two sounds that would be produced. One is a lub and the dup sound. The lub sound is produced on the closure of tricuspid and bicuspid valves, which occurs on the onset of ventricular systole. The dup sound will be heard on the closure of the semilunar valves. This occurs on the onset of the ventricular diastole. The blood vessel that brings deoxygenated blood from the right auricle from the upper parts of the body is the precaval vein, which can also be called the superior vena cava. How many times will an erythrocyte pass through the heart on its journey from hepatic artery to aorta? Wherever we come across the word hepato, it says it is liver. See, the digested food on absorption enter into the liver. From there it reaches the heart through the right into the right atrium. From there it is pumped to the lungs, where it gets oxygenated, and it is pumped back to the heart into the left auricle. So this erythrocyte passes twice through the heart. The hardening of the walls of the arteries due to deposition of the fat is said to be atherosclerosis. Stenosis, it says, it is nothing but stickiness of the valves. Thrombosis is the blood clot that would be formed. MI is nothing but a heart attack. The World Heart Day is on September 29th. November 14th, no doubt it is Children's Day, but it is World Diabetes Day too. Obviously, February 14th, we all just say it's a Valentine's Day. April 7th is the World Health Day. To store an anticoagulant, to store the blood, an anticoagulant that is added is sodium citrate. What does the sodium citrate do? It just binds up and prevents the clotting when the blood is just stored. It binds to the calcium, henceforth there is no clotting that occurs. Identify the components labeled A to D in the given flowchart of the blood clotting process. Injured tissue releases A, it is thromboplastin synonymously. Thrombokinase can also be used. In presence of B is thrombokinase. The prothrombin activates into C, is nothing but thrombin. Later, in the presence of the thrombin, the fibrinogen converts into D. D is nothing but fibrin. So A is the correct option. If X is the rhythmic contraction and relaxation in the aorta and its main arteries, what is X? X is nothing but the pulse. So that's it, children. So what little is possible, the PU board is helping you. Make best use of it. So become very good citizens to the society. That is most important. And I wish you a very best of luck for your future. Thank you.